Hi, and welcome to my channel, and if you've been here before, welcome back. I'm Dr. Arti Thangudu. I'm a physician who specializes in diabetes, thyroid, and other hormonal and metabolic conditions. My goal with this channel is to provide education to patients who may not be able to see me in clinic. As you may or may not know, there is a huge shortage of endocrinologists in the United States. And so I hope to walk you through some topics like I would my patients in my clinic. Today, we're going to talk about Sglt2 inhibitors. These are a newer class of diabetes medications. If you haven't already, please check out my other videos on insulin resistance, lifestyle modifications that can improve diabetes, and some other medications. So let's talk about Sglt2 inhibitors. Sglt2 inhibitors are a newer class of diabetes medications that help you pee out more sugar. They work on the kidney to decrease the amount of glucose that is reabsorbed through the kidney. Normally, the kidney filters glucose, and much of that glucose is reabsorbed at the proximal tubule. These inhibitors work at that location to inhibit some of that reabsorption. What it means to reabsorb glucose is the kidney brings the glucose back into the system. These medications help stop as much sugar from being brought back into your bloodstream. So these medications don't work on the pancreas. They don't cause the pancreas to secrete more insulin. They don't require a functional pancreas to work. So patients in late stages of diabetes, those with pancreatic insufficiency, those who don't produce much insulin, are candidates for these medications. These medications lower A1C on average by about 0.5 to 1% depending on the patient. Another great thing about these medications is they have been demonstrated to improve cardiovascular and renal outcomes. That means they've shown reduced risk in heart problems and kidney problems in patients with diabetes. These are two major organs that we worry about a lot when we think about complications of diabetes. The most common side effects of Sglt2 inhibitors are yeast infections and urinary tract infections. They don't happen to everybody, but they can be very uncomfortable if they do occur. So make sure you talk to your doctor about whether you have frequent UTIs or yeast infections before you start these medications. Another rare side effect or adverse effect of these medications is something called Euglycemic Dka. Diabetic ketoacidosis is a complication of diabetes that often lands patients in the hospital. Usually, diabetic ketoacidosis is associated with very high blood sugar. Sglt2 inhibitors, though, can cause diabetic ketoacidosis at normal blood sugar levels. If you are at risk for diabetic ketoacidosis, definitely discuss this with your doctor before starting one of these medications. If you have impaired kidney function, that's also something to discuss with your doctor before you start one of these medications. Newer data has shown improvement in kidney function with these medications. However, kidney function definitely needs to be discussed prior to initiating these meds. Sglt2 inhibitors do produce a modest amount of weight loss, which is a beneficial side effect for many of our patients with type 2 diabetes. Let me know if you have any questions about Sglt2 inhibitors. These are great newer medications to discuss with your doctor if you have type 2 diabetes. Again, thank you so much for listening. I'm here for you and so happy to have you here. Please don't forget to like and comment, and please share with any friends or family members who you think could benefit from this information. Thanks so much and see you next time.